Welcome to the Cervical Cancer series. This is an educational program that is going to educate every woman, including men and the youth generally, on what cervical cancer is, its risk factors, and how we can all live to prevent such a deadly disease. It claims the lives of many women every year. And I am told that in Ghana, the prevalence rate has gone so high. And that is why it's very important that in the month of January, which is the Cervical Cancer Awareness Month, we also put in our quota to educate and inform the whole world, especially a lot of women in Ghana, about this deadly disease called cervical cancer. My name is Gladys Osei Oredu, and for the month of January, I am going to be bringing you this series to make sure that it reaches every end of the country, for every Ghanaian woman to be also informed and take good care of themselves. We get into the conversation with a medical doctor who has the opportunity to meet first-time women who may be going through symptoms or signs that they themselves are not aware of, and she will run us through how it even starts. She would also give us an idea of what the cervix, what is actually what this cervix thing we're talking about that actually generates into cancerous cells that we call the cervical cancer. It's basically talking about your cervix. Well, we get to get more informed about this in a moment after this break.
Say ye busuen achadia sronko asum ye buye pa ene ya pomuden enti na sesa wo de nice sunflower oil ene ye waduane na boa wa pomuden eye cholesterol free obo ade anuane no te se vitamins ni omega 3 ahyemu ma be se wo de nice sunflower oil ye aduane si ho a enna anwapa esesa busue bia de ye waduane kai se apomudi amapa bia hyase any aduane pa.
Oh yeah.
Nice sunflower oil. Eye bedi anko, udi ba ko a, ubedi sa. Aduane pa anko a.
Medofo se wo pe TV commercials ana documentary ana uhia. Ana se wo pe live streaming bia dia. Eye Afa Angels production and I may come for the amount. Medase.
Welcome back. If you have just tuned in, this is a conversation on cervical cancer. We call it the Cervical Cancer series here on the U channel. You can get us on Facebook, Instagram, and of course, right here on YouTube. And so earlier on, I mentioned that we have a practitioner, a practicing doctor, a general practitioner actually, who will run us through where it starts from. What is cervix? what becomes cervical cancer. She will take us from this like a startup conversation to get us into the real deal that we all need to know about. Let me quickly say thank you to our sponsors, Labadi Beach Hotel, for this beautiful space. I am always grateful to you for your warmth. If you have that wedding reception conference or just a relaxation swimming or anything, please, Labadi Beach Hotel offers you much more. Is it a getaway vacation or you need a room to, just a getaway? Yeah, you can always count on Labadi Beach Hotel for that relaxation. Special thank you to Lester Ghana. Special thank you to the team from Dodu's Multimedia. Thank you so much for being on board this project. And of course, as we go on, I'll let you know who our other supporters are to make this what it is now. I have with me Dr. Nana Adwoa. She is a medical doctor with Rage Hospital, and she gets us into the startup conversation on what your cervix is and what leads into cervical cancer. Doctor, you're welcome.
Thank you.
So Happy New Year's in order.
Happy New Year to you too.
All right. So yes, I realized in my few encounters with other young women, even men who are the carriers, that a lot of them still do not know about cervical cancer. But first, let's understand what is the cervix and what does it do in a woman's body. Then we can actually get into the details.
Okay. So the cervix forms part of the uterus, or what the layman calls the womb. It's about 3 centimeters long. And the cervix mainly forms a link between the uterus and then the vagina. So during intercourse, the semen passes through the cervical canal into the womb and then travels up into the fallopian tubes to fertilize the eggs or the ovum. And also the cervix too can also play a role in contraception. Maybe someone doesn't want the pills, she can go to the hospital where they can place some caps or some diaphragms on the cervix. So the cervix is closed. Under normal circumstances, it's supposed to be closed, but it's not completely obliterated. There's a tiny passage where the semen can pass through. So they place a cap there to cover that hole. And then also during childbirth, the cervix becomes softer. And first of all, when the woman is about to go into labor, the cervix forms like a support for the presenting part of the fetus, usually the head. And as the labor progresses, the cervix becomes shorter and wider, what we call effacement, until it's completely dilated to about 10 cm to allow for the passage of the fetus. So that's basically the cervix.
This unfortunately is not in our local language, but there's also that woman out there watching who this will sound a bit too academic, and so help us break it down a bit more. So how do I even know as a woman that the cervix in my own body, do I touch it? Am I able to touch it? How does it feel like if the cervix,
So for the cervix, you are not supposed to be able to touch your cervix. I mean, it's not hygienic to be inserting your hand in your vagina, but if you happen to insert your hand into your vagina, it's way up. So you shouldn't be able to do. But if you're able to see your cervix and touch it, that's a different medical condition that we have to do. But during pregnancy, when we do our vaginal exam and everything, we're able to touch the cervix and then assess whether it's opened or if it's closed, and if it's open, how many centimeters is opened, basically.
Do you have people coming to you with complaints of, I think my cervix is painful, or I think there's something wrong with my cervix? Is it where it is in the body? Would anybody at all come and make a complaint like that?
People hardly come and make specific complaints like my cervix is paining me. No, maybe they would rather see it as pain in their vagina. They would perceive it as that, or pain in their lower abdomen. That's what they will come and tell us. And then based on our investigations and then our clinical examination, we can say, okay, there's a problem with the cervix or something else.
So in other words, what it means is that the cervix is at a position or within a certain part of the body where you can barely see, touch, or even feel it until only a medical practitioner.
Yes, because it's the neck of the womb.
Okay.
So if you take the anatomy, when you take the womb, then you come to the cervix, then you come to the vagina,
okay,
then you come to the vulva.
Oh, okay.
So that's
can one live without the cervix?
Well, you can, if for some medical reason the whole womb is taken away, that means total hysterectomy, that means the whole womb and the cervix is taken away, such a woman can still live her life.
Okay, so there's no way the womb will be taken off and the cervix will be left. It goes together.
There are different types of hysterectomies.
Okay.
So depending on what condition that has affected either the womb or the cervix, the whole womb can be taken away with the cervix, or maybe they will do partial or subtotal, so part of the womb and then the cervix is left. Okay.
Let me just go straight into our focus. Okay. So when women are diagnosed of cancer in the cervix, you are a start-off person because you meet all manner of different sicknesses per way you said.
Yes.
And so how are you able to tell that, no, this needs to be referred to a specialist in the first place, because it could be something that is hinting of cancerous cells?
Mostly, most women will complain of abnormal uterine bleeding, or bleeding usually after they have had intercourse.
Okay.
Or maybe they bleed in between their menses, or they know, every woman should know what is normal for her. Maybe when you have your menses, you use maybe 3 or 4 pads in a day, but suddenly you are using 6 pads in a day.
Okay.
It's not normal for you. So they come with such kind of complaints, and then we do our investigations, and then we advise for them to see the specialist, or we refer to the specialist. Yes.
The investigation you do is my interest here, because I'm sure that's what leads to you knowing that, no, this must be something suspicious of cancerous or something like that.
What we mainly do, the most common routine exam that we do is what we call the pap smear.
Okay.
So for them, when they come to the hospital or to the facility, we pass a speculum, we have a look at the cervix, we take part of it, and then we take a look under the microscope, and then we give our report based on or a report is given based on what is found. Okay.
Yes. So it starts from the complaint. I may be having abnormal bleeding, or I may be having bleeding after intercourse, or painful intercourse, or vaginal infection. I feel this funny irritation, or pungent discharge that is coming out. And so that is where it starts from.
That's where it starts
so that is what calls for the special examination. Yes. Once you examine and you get into knowing that, no, these are not regular behavior of the cervix, or these things we are seeing do not is suspicious of cancer or something like that, that is when you take to the specialist. Okay, so we're talking to a lot of women out there. Please, we want to encourage everyone to check. Why must they even check? Must they all wait to have these kind of symptoms before they come in to check on their cervix? Or why would a woman have a reason to want to even check on a regular day with no problem or complaint?
I would encourage every woman above 20 years to be screened at least once a year. And now that we are in the Cervical Cancer Awareness Month, a lot of facilities will be doing programs in that regard. So let's take advantage of that, because early detection is key. The earlier we catch the disease, we're able to treat it, because cervical cancer is treatable and it's also preventable. So let's endeavor to get tested. Let's not be afraid of cancer. The earlier we start treating, the better. That's what I have to say.
The earlier we start treating, the better. 2 women get to win the opportunity to go and screen for free at our cost. And so if you're watching, we'll put out what you need to do to be that lucky person to go have a screening. And so don't miss. Share the link. Just tap on the like button and let's get going. Let's preach this to every woman out there. You never know, you may be that lucky winner.